You've probably noticed that as you get older, a good night's sleep doesn't come as easily as it once did. Maybe you wake up frequently during the night, struggle to fall asleep, or feel unrested even after hours in bed. You're not alone. Sleep issues are incredibly common among older adults, and there are several reasons why. First, aging naturally changes your sleep patterns. Deep sleep, the most restorative phase, decreases with age, making you more susceptible to waking up at slight disturbances. Hormonal shifts, such as lower melatonin production, can also disrupt your internal clock. Add in common health conditions like arthritis, heartburn, or an overactive bladder, and it's no wonder sleep feels elusive. But here's something you might not have considered. Magnesium deficiency could be silently worsening the problem. Research suggests that up to 70% of older adults don't get enough magnesium from their diets. This mineral is crucial for relaxing muscles, calming the nervous system, and regulating neurotransmitters that promote sleep. Without enough magnesium, your body may struggle to wind down at night, leaving you tossing and turning. Stress and medications can further deplete magnesium levels. Diuretics, often prescribed for high blood pressure, flush out magnesium, while chronic stress burns through it faster. The result? A vicious cycle where poor sleep raises stress, and stress drains magnesium, making sleep even harder. The good news? Addressing this deficiency might be a simple yet powerful way to reclaim restful nights. In the next sections, we'll explore how magnesium works, the best forms for sleep, and how to use it safely. For now, consider this. If you're frequently fatigued, dealing with muscle cramps, or feeling unusually anxious at bedtime, low magnesium could be a hidden culprit. Let's move forward and uncover how this humble mineral can become your ally for deeper, more restorative sleep. If you've ever wished for a natural way to quiet your mind and relax your body before bed, magnesium might be the answer. This essential mineral acts like a gentle, internal lullaby, helping your nervous system shift from alert to rest. But how exactly does it work? Calming the nervous system, magnesium regulates GABA, a neurotransmitter that slows down brain activity. Low GABA levels are linked to insomnia and restless thoughts at night. By boosting GABA, magnesium helps silence mental chatter, making it easier to drift off. It also blocks stress hormones like cortisol, which can keep you wired when you should be winding down. Relaxing muscles. Ever notice tension in your legs or back that makes sleep difficult? Magnesium acts as a natural muscle relaxant by balancing calcium, which triggers contractions. Without enough magnesium, muscles may cramp or twitch, leading to discomfort or even restless leg syndrome, RLS, a common sleep disruptor for seniors. Regulating melatonin. While magnesium doesn't directly contain melatonin, it supports the enzymes that produce it. Think of it as the backstage crew ensuring your body's sleep-wake rhythm stays on schedule. Studies show magnesium deficiency correlates with lower melatonin levels, further complicating sleep. Reducing inflammation. Chronic inflammation is a stealthy sleep thief, often worsening pain and stiffness at night. Magnesium's anti-inflammatory effects may ease these issues, particularly for conditions like arthritis. A key insight: magnesium doesn't knock you out like a sleeping pill. Instead, it creates the ideal conditions for sleep by addressing root causes, stress, tension, and biochemical imbalances. In the next section, we'll compare magnesium types to find the best form for your needs. Not all magnesium supplements are created equal. Some forms are better absorbed, while others excel at specific benefits like sleep support or digestive health. Let's break down the most common types so you can choose wisely. Magnesium glycinate. The sleep champion. This form binds magnesium to glycine, an amino acid that enhances relaxation. Glycine itself has mild sedative properties, making this combo ideal for reducing nighttime awakenings, easing anxiety-related insomnia, minimizing side effects, gentlest on digestion. Studies show glycinate raises magnesium levels efficiently without causing laxative effects, perfect for seniors prioritizing sleep. Magnesium citrate, balanced benefits. Citrate is highly bioavailable and often used for both magnesium replenishment and occasional constipation relief. However, its mild laxative effect may disrupt sleep if taken too close to bedtime. Better suited for daytime use or those needing digestion support. Magnesium oxide. Cheap but limited, common in drugstore supplements, oxide has poor absorption, only 4% utilized. It's mainly used for quick relief of heartburn, indigestion, high-dose magnesium when absorption isn't critical, not recommended as a primary sleep aid due to low effectiveness. Less common but notable forms. Malate may help with muscle pain, fatigue, good for arthritis sufferers. L-threonate, emerging research for brain health, but less evidence for sleep chloride. Often used topically, e.g. oils, sprays, for localized muscle relaxation. Key takeaway: glycinate is the gold standard for sleep, while citrate works well as a daytime supplement. Avoid oxide for sleep purposes. Up next, precise dosing strategies to maximize benefits. Now that you understand the different types of magnesium, let's focus on identifying the absolute best form for improving sleep, especially for older adults. The winner? Magnesium glycinate. And here's why. Why magnesium glycinate stands out: superior absorption and gentle on digestion. Unlike magnesium oxide, which can cause digestive upset, glycinate is highly bioavailable and non-laxative. This means your body can actually use most of the magnesium you consume without unpleasant side effects. Glycine's calming boost. The glycine in this compound isn't just a carrier, it's an amino acid that acts as an inhibitory neurotransmitter. Studies show glycine can lower core body temperature, a key signal for sleep onset, reduce nighttime awakenings, improve sleep quality without next-day grogginess. Targeted relaxation. Magnesium glycinate excels at calming both the mind and body. It's particularly helpful if you struggle with anxiety or racing thoughts at bedtime, restless legs syndrome, RLS, muscle tension that disrupts sleep. How it compares to other sleep-friendly options. Citrate works well but may cause loose stools if taken in higher doses before bed. L-threonate supports brain health but lacks strong sleep-specific research. Malate. Great for daytime energy but not optimized for nighttime use. What to look for in a quality supplement. Third-party testing, NSF, USP or consumer lab approval. No unnecessary fillers. Avoid magnesium stearate, artificial colors. Dose per serving, 200-400 mg. Elemental magnesium is ideal for sleep. Pro tip: if you're new to magnesium glycinate, start with 100-200 ml about 30-60 minutes before bed, then gradually increase as needed. Finding the right dose and timing for magnesium can make all the difference between restless nights and deep, restorative sleep. Too little may not help, while too much could cause unwanted effects. Let's break down the science-backed strategies for seniors. Ideal dosage for sleep. Support research suggests 200-400 mg of elemental magnesium per day is optimal for improving sleep in older adults. However, factors like your diet, medications, and individual tolerance matter. Here's how to personalize your intake. Start low. 100-200 ml means. If you're new to magnesium, begin with a smaller dose to assess tolerance. Gradually increase. After a few nights, you can adjust up to 300-400 ml if needed. Watch for signs of excess. Loose stools, nausea, or excessive drowsiness may mean you've gone slightly over your ideal dose. Note: the elemental magnesium amount is key. Check supplement labels to see how much actual magnesium you're getting per serving, not just the total compound weight. Best time to take magnesium for sleep: 30-60 minutes before bed. This allows magnesium to peak in your system right as you're trying to fall asleep. With a light snack, optional. A small amount of food may enhance absorption for some, but avoid heavy meals that could interfere with sleep. Avoid late afternoon dosing. Taking it too early, e.g. 3 to 4 p.m., might not align with your natural sleep-wake cycle. Special considerations if you take medications. Magnesium can interact with certain drugs, like antibiotics or blood pressure meds. Space them at least 2 to 4 hours apart. Kidney function. Those with kidney issues should consult a doctor before supplementing, as excess magnesium can be harder to excrete. Pro tip: keep a sleep journal for a week. Note your dose, timing, and sleep quality. This helps fine-tune what works best for you. While magnesium is a powerhouse for sleep on its own, pairing it strategically with other nutrients can create a synergistic effect, like assembling a dream team for your nighttime rest. Let's explore the most effective combinations and how they work together to enhance sleep quality naturally. The Magnesium Synergy Trio. Magnesium Plus. Melatonin. Melatonin is your body's natural sleep hormone that regulates circadian rhythm. Magnesium helps activate the enzymes needed for melatonin production, ideal pairing for those with jet lag or shift work. Sleep disorder suggested ratio: 200-300 mg magnesium glycinate plus 5-3 mg melatonin magnesium plus L-theanine, found in green tea, promotes alpha brain waves for relaxed alertness. Complements magnesium's GABA-enhancing effects, particularly helpful for anxiety-related insomnia. Effective dose: 100-200 mg L-theanine. With your Magnesium Plus, glycine, already present in magnesium glycinate, can be boosted further. Acts as an inhibitory neurotransmitter to quiet neural activity. Shown to improve sleep quality metrics in clinical studies. Additional 1-3G. Glycine can be taken with magnesium supplement, supporting CAST nutrients. Vitamin B6 helps convert tryptophan to serotonin, precursor to melatonin. Calcium works in balance with magnesium for muscle relaxation. Zinc plays role in melatonin synthesis. And neurotransmitter regulation. Timing considerations. Take combinations 30 to 60 minutes before bedtime. Start with lowest effective doses of each component. Allow 2 to 3 weeks to assess full effects before adjusting. Safety notes: always discuss new supplement combinations with your healthcare provider. Be especially cautious with melatonin. If you have autoimmune conditions, monitor for morning grogginess when combining multiple sleep aids. Even natural supplements like magnesium can sometimes cause unwanted effects, especially in older adults with sensitive systems. But don't worry. Most side effects are mild and easily managed with the right approach. Let's walk through what to watch for and how to prevent issues before they disrupt your sleep journey. Common side effects and solutions: digestive upset, diarrhea, cramping, nausea. Why it happens. Magnesium draws water into the intestines, which can loosen stools, especially with oxide or citrate forms. Switch to glycinate or threonate, which are gentler on digestion. Take with a small snack, like banana or oatmeal. Split your dose, e.g. 100 mg with dinner plus 100 mg at bedtime. Drowsiness or brain fog the next day. Why it happens. Taking too much, especially with melatonin or glycine, can lead to residual sedation. Lower your dose by 50-100 mg. Avoid combining with other sedating supplements initially. Low blood pressure, dizziness, lightheadedness. Why it happens. Magnesium relaxes blood vessels, which can amplify blood pressure medications. Monitor BP if you take antihypertensives. Take magnesium at least 2 to 4 hours apart from meds. Muscle weakness, rare at normal doses. Why? It happens. Excessive magnesium can over-relax muscles. Stay within 400 mg day unless directed otherwise by a doctor. Ensure you're also getting enough calcium. They work in balance. Who should be extra cautious? Kidney disease patients, impaired magnesium excretion. Those on diuretics or heart medications, risk of electrolyte imbalance. People with myasthenia gravis, magnesium may worsen muscle weakness. Pro tip: if side effects persist after adjustments, try topical magnesium, oil, or spray. It bypasses digestion entirely. Getting magnesium from whole foods is ideal, but for many seniors, diet alone may not be enough. Let's compare food sources and supplements so you can make the best choice for your sleep needs. Top: magnesium-rich foods for seniors. These foods pack the most magnesium per serving while being easy to digest. Pumpkin seeds, 156 megacorn per 1 oz. Sprinkle on oatmeal or yogurt spinach, cooked, 157 mg per 1 cup. Add to soups or eggs black beans, 120 mg per 1 cup. Grate in chili or salads almonds, 80 mg per 1 oz. Perfect evening snack dark chocolate, 70% plus, 64 mg per 1 oz. A delicious pre-bed treat problem? Older adults often eat less due to reduced appetite or dental issues. Medications depleting magnesium, like PPIs for acid reflux. Digestive changes that impair nutrient absorption. When supplements make sense, consider magnesium glycinate supplements. If you struggle to eat enough magnesium-rich foods daily, have sleep issues despite a decent diet, take medications that drain magnesium, diuretics, antacids. Want targeted sleep support? Foods can't match glycinate's calming effect. Best of both worlds approach. Base intake on foods. Aim for 2-3 servings of magnesium-rich foods. Daily supplement strategically. Add 100-200 mg. Glycinate at bedtime as needed. Bonus tip: soaking nuts, seeds overnight boosts magnesium availability, making them easier to digest. Before you begin any magnesium regimen, there's one crucial step you shouldn't skip: talking to your doctor. While magnesium is generally safe, your unique health profile requires personalized advice. Here's why medical guidance is non-negotiable. For seniors considering supplementation, medication, interactions, you need to know about magnesium can significantly affect how certain medications work. Antibiotics, quinolones, tetracyclines. Magnesium binds to these drugs, reducing their effectiveness. Take them 2-4 hours apart. Blood pressure medications may enhance effects, potentially causing excessive blood pressure drops. Diuretics. Some, like hydrochlorothiazide, increase magnesium loss, while others, like spironolactone, can raise magnesium levels too high. Bisphosphonates, osteoporosis drugs. Magnesium can interfere with absorption. Special health considerations: your doctor will assess kidney function. Impaired kidneys can't excrete excess magnesium properly. Heart conditions. Those with heart block or severe bradycardia need careful dosing. Neuromuscular disorders. Conditions like myasthenia gravis may worsen with magnesium electrolyte imbalances. Magnesium affects calcium, potassium, and sodium balance. What to ask your doctor? Prepare for your consultation with these key questions. Based on my latest blood work, do I show signs of magnesium deficiency? How might my current medications interact with magnesium supplements? What's the safest form and dose for my specific health conditions? Should we monitor my magnesium levels periodically? Red flags to report. Immediately, while rare, seek medical help if you experience severe diarrhea or vomiting muscle weakness, or irregular heartbeat confusion or extreme drowsiness. The smart approach: get baseline blood tests, serum magnesium and RBC magnesium. Start with the lowest effective dose. Schedule follow-up tests if taking long-term. Now that you understand magnesium's role, let's combine it with other science-backed strategies for a comprehensive sleep solution tailored to older adults. Think of this as your step-by-step blueprint for better rest. Step 1. Magnesium supplementation. Protocol form: magnesium glycinate, 200-300 mg timing, 30-60 minutes before bed. Enhancers: Consider pairing with 1,2-G glycine or 0.5 milligram melatonin if needed. Adjustment period. Allow 2 to 3 weeks to see full effects. Step 2. Sleep-promoting nutrition dinner. Strategy: include magnesium-rich foods, spinach, pumpkin seeds, black beans. Avoid heavy, spicy, or acidic foods. 3 hours before bed, try a small carb-rich snack, banana plus almond butter, if hungry at night. Step 3. Circadian rhythm. Reset morning light. Get 15 to 30 minutes of sunlight before noon-evening. Wind down, dim lights. 2 hours before bed, switch to amber-toned bulbs or candles. No screens after 8 p.m. or use blue light blockers. Step 4. Sleep environment. Tweaks temperature. Keep bedroom at 65-68 degrees, 18 to 20 degrees Cs. Comfort: memory foam, mattress topper for pressure. Relief sound: white noise machine or fan to mask disruptions. Step 5. Movement and relaxation, gentle. Evening stretches. Focus on hips, hamstrings, and shoulders. 4, 7, 8. Breathing. Inhale 4 sec, hold 7 sec, exhale 8 sec. Repeat 4 os. Progressive muscle relaxation. Tense, release each muscle group from toes to head, tracking progress. Keep a simple sleep log tracking. Time taken to fall asleep. Number of awakenings, morning energy levels, 1-10 scale. When to reassess if no improvement after 4 weeks. Recheck magnesium. Dose with doctor, consider sleep study for underlying issues. Explore stress management techniques. Thank you for investing this time in understanding how magnesium and smart sleep strategies can transform your rest. Remember, better sleep isn't just about feeling refreshed tomorrow. It's about protecting your long-term brain health, emotional balance, and physical vitality. Track changes. Notice even subtle improvements in sleep quality. Share your story. Your experience could help others in our community. Sweet dreams and vibrant health await. You've got this.